Right now, somewhere in your house, there is a pair of shoes sitting by the door that fit perfectly this morning. Tonight, when you try to put them back on, they will not fit the same way. Your socks will leave a deep groove pressed into your skin. Your ankles will look softer, rounder, almost like someone replaced them while you were not looking. And most people over 50 have trained themselves to shrug this off. Long day, too much salt, old age, nothing to see here. But your body does not swell for no reason. Every single evening, your legs are sending you a report. Tonight, I am going to teach you how to read that report, because sometimes it says rest, and sometimes that exact same swelling, dressed up in a slightly different way, is your body telling you something about your heart, your kidneys, or a blood clot that will not wait for morning. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and I have spent the last 15 years working with men and women over 50 who want to catch problems while they are still small and quiet. Leg swelling is one of the most common things patients bring to me, and it is also one of the most misread because the same word, swelling, can mean two completely different stories depending on how it shows up. Before we go further, I want to ask you something, because your answer changes how you should think about everything I am about to say. When your legs swell in the evening, is it both legs equally, or is one leg clearly worse than the other? Keep that answer in your mind. We are coming back to it, and it might be the single most important detail in this entire video. I want you to know something up front, and I mean this sincerely. This channel exists because I believe you deserve to understand your own body, not just be handed a prescription and sent home. If that matters to you, consider staying connected here. Not for a number, but because this is turning into a place where people are learning to take care of themselves before a small warning sign becomes a hospital stay. That is the whole point, and I would love for you to be part of it. Here is a pattern I want you to sit with for a moment. Morning, your ankles look normal. Afternoon, your shoes start feeling snug. Evening, the skin over your shin bone looks shiny and tight, and if you press a fingertip into it, a small dent stays behind for several seconds before it slowly fills back in. Overnight, it mostly resolves. Morning comes, and it looks normal again. Then the cycle repeats, sometimes for years, without a single conversation with a doctor about it. Does that sound familiar? If it does, you are not alone. I want to walk you through this by explaining what is actually happening under your skin, because once you understand the mechanism, you will never look at swollen ankles the same way again. Think about your circulatory system for a moment. Your heart pumps blood downward to your legs with the help of gravity, the easy direction. Getting blood back up to your heart is the hard direction, since it must travel uphill through veins that have no pump of their own. Instead, your veins rely on two things. The first is a network of one-way valves that act like little trapdoors, letting blood pass upward, then snapping shut so it cannot fall back down. The second is your calf muscles, which squeeze the deep veins every time you walk, acting almost like a second heart in your lower legs. Now imagine you sit for long stretches, whether that is in a car, at a desk, or in a favorite recliner. Your calf muscles stop squeezing. That second heart goes quiet. Gravity keeps pulling fluid downward all day, and without the muscle pump helping push it back up, fluid slowly seeps out of your small blood vessels and pools in the soft tissue around your ankles and lower legs. That is ordinary dependent edema, and by evening, after 8 or 10 or 12 hours of gravity winning uncontested, your ankles show it. Here is the myth I want to dismantle directly, because almost everyone over 50 believes it. Swollen legs at the end of the day are just a normal part of getting older. Nothing to be done except put your feet up. Here is the reality. Ordinary dependent swelling from sitting too long is common and usually harmless. But that same word, swelling, is also one of the earliest signs of chronic venous insufficiency, congestive heart failure, kidney disease, liver disease, certain medications, and in the most urgent case, a blood clot. The cause underneath can be wildly different. That is exactly why this video exists. Let us talk about the valves I mentioned a moment ago, because this is where a huge number of my patients over 50 actually live. Picture the one-way valves in your leg veins like small doors stacked up a staircase, each one designed to let blood pass through going up, then close firmly so nothing slides back down. Over years of standing, sitting, pregnancy for some of you, or simply the wear of time, those valve doors can weaken. Blood that should be climbing upward instead slips backward through the gap, pools lower in the leg, and stretches the vein wall. Doctors call this chronic venous insufficiency, and I want you to hear that term clearly and then immediately understand it in plain language. Chronic venous insufficiency does not usually announce itself with pain at first. It shows up quietly, as swelling that is worse by evening and better by morning, as visible veins that look twisted or rope-like just under the skin, sometimes as a heavy, aching, tired feeling in the legs by late afternoon, and over years, as skin near the ankle that becomes darker, thicker, or even develops a slow healing sore. Research consistently links prolonged standing occupations, excess body weight, and a family history of varicose veins to a much higher lifetime risk of this exact pattern. Now let us talk about a completely different mechanism, because this is the one that keeps me thinking carefully when a patient describes it to me over the phone instead of coming in. Your heart has two sides. The right side receives blood coming back from your body, including your legs, and pumps it onward to your lungs. When the right side of the heart starts to weaken, blood backs up behind it, the way cars back up behind a slow toll booth. That backup travels down through the large veins and shows up as fluid pooling in your legs, your ankles, and sometimes your abdomen. This is one of the classic early signs of congestive heart failure, and here is what makes it dangerous. It can look, at first glance, almost exactly like ordinary end-of-day swelling from sitting too much. So how do you tell the difference between a leaky valve pooling blood locally in the leg and a struggling heart backing fluid up through the entire system? This is where I want you to pay very close attention, because these details matter more than almost anything else in this video. With heart-related swelling, both legs are usually affected fairly evenly, not just one. It often comes with other clues stacking up alongside it, including shortness of breath when you lie flat, a sudden unexplained weight gain of several pounds over just a few days, a persistent cough or wheeze at night, and a feeling of abdominal bloating. If several of those show up together with the leg swelling, that combination deserves a same-week conversation with your doctor. Now let us go back to the question I asked you earlier, because this is the moment it matters most. Is your swelling in both legs, or mainly in one? If it is one leg, and that leg becomes swollen relatively suddenly, especially if it is also warm to the touch, red, or painful, particularly with a deep ache in the calf that worsens when you flex your foot upward, that combination can signal a deep vein thrombosis, a blood clot lodged in one of the deep veins of the leg. I am not telling you this to frighten you. I am telling you this because a clot like that, left unaddressed, carries a real risk of breaking loose and traveling to the lungs, becoming a pulmonary embolism, a genuine medical emergency. Sudden one-sided swelling with pain, warmth, or redness is one of the very few situations in this video where I want you to stop watching and call your doctor or go to urgent care the same day. I also want to mention the kidneys and the liver, because both play quiet but powerful roles in whether fluid stays where it belongs. Your kidneys help regulate how much salt and fluid your body holds on to. When kidney function declines, whether from long-standing high blood pressure, diabetes, or age-related changes, your body can retain more fluid than it needs, and that extra fluid often shows up first in the lowest, most gravity-dependent parts of your body. Your liver produces a protein called albumin that helps keep fluid inside your blood vessels instead of leaking into surrounding tissue. When liver function is impaired, albumin production drops, fluid leaks out more easily, and swelling can follow, sometimes alongside abdominal swelling as well. And then there are medications, which almost nobody thinks to blame, but which I ask about in nearly every conversation. Certain blood pressure medications, particularly a class called calcium channel blockers, are well known to cause ankle swelling as a side effect, sometimes significant enough that patients assume something is wrong with their heart, when actually it is the medication itself. Certain anti-inflammatory medications taken regularly for joint pain can also cause the body to retain sodium and fluid. If your swelling started or worsened around the same time you began a new prescription, that timing is not a coincidence you should ignore, and it is worth bringing up at your next appointment rather than adjusting your dose on your own. I think of a pattern I see constantly in my practice. A patient in their 60s describes evenings where their ankles balloon, their favorite shoes stop fitting by dinner time, and they have quietly assumed for years this is just what getting older feels like. Often, once we examine the pattern together, both legs equally swollen, worse by evening, better by morning, no pain, no shortness of breath. The explanation really is straightforward venous pooling combined with weakening valves over the years. We start compression stockings, elevation, and short walking breaks, and within weeks that patient's ankles look like they did a decade ago. But every so often, when I ask, has this started recently? Is one leg worse than the other? Are you more short of breath? The story shifts, and what looked like a boring complaint turns into an urgent referral that genuinely changes that person's trajectory. The swelling itself rarely tells the whole story on its own. The details around it do. Let us talk honestly about the system for a moment because I think you deserve honesty here. Most of the resources in our healthcare system are structured around treating illness once it has already declared itself, far less around the quieter work of prevention. A brief conversation about swollen ankles at the end of a routine visit often gets rushed past because the system rewards addressing the crisis in front of it, not the pattern building quietly in the background. I am telling you this not to make you distrustful of your own doctor. Most of us genuinely want to help you, but so you understand why paying attention to your own body's signals matters so much. Nobody is going to flag this pattern for you automatically. You are the one who notices it first, every single time. I want you to do something with me right now, while you are still watching. Sit forward and press your thumb firmly into the skin just above your ankle bone for about 5 seconds. Then let go. If a visible dent stays there for several seconds before slowly filling back in, that is called pitting edema, and it tells you there is measurable extra fluid sitting in that tissue right now. If the skin springs back almost immediately, that is a more reassuring picture. Try this tonight when your legs are at their most swollen, since the test only means something when the swelling is at its worst. This is exactly the moment where a widely repeated piece of advice needs correcting. Many people believe that if you drink less water, your legs will swell less. The opposite is often true. When your body senses you are dehydrated, it becomes more aggressive about holding onto every drop of fluid it has, including in your leg tissue, which can make swelling worse, not better. Staying hydrated, alongside moderating sodium rather than restricting fluids, is what fluid balance research actually supports. Let me give you a mental image that might help this stick. Think of your leg veins after years of valve wear like an old garden hose squeezed flat in one section. Water still gets through, but it pools and bulges just before that pinch point, the same way blood pools below a weakened valve. And think of a struggling right side of the heart like a small pump trying to keep up with a fire hose worth of returning blood, falling gradually behind, so the backlog builds all the way into your ankles. Two very different plumbing problems, producing a remarkably similar puddle by evening. Can I ask you something? Has this happened to you before? The shoes not fitting by evening, the sock line pressed into your skin, and if so, have you ever mentioned it to your doctor? Or did you assume, like so many people do, that it was simply not worth bringing up? I would genuinely like to know because it helps me understand what to cover next on this channel. Now, here is something that surprises almost everyone I explain this to. One of the biggest predictors of how bad your evening swelling will be is not how much water you drank that day. It is how many hours you spent with your legs below your heart without moving. 2 hours on a plane can rival 8 hours at a desk if you never once flex your ankles. Your calf muscle pump does not care why you are sitting still. It only cares whether it gets used. Let me also address compression stockings directly, because I know some of you already own a pair sitting unused in a drawer because they felt uncomfortable or confusing the first time you tried them. Properly fitted graduated compression stockings apply the most pressure at the ankle and gradually less pressure moving up the leg, which mechanically assists your weakened valves in pushing blood upward instead of letting it pool. They are genuinely one of the most effective, lowest risk tools available for ordinary venous swelling, but fit matters enormously. If you try them, either get measured properly at a pharmacy or medical supply store, or ask your doctor for a proper fitting referral rather than guessing your size online. I want to ask your age here, and I mean that literally, because the recommendations after this video are shaped by how old you are. Someone in their 50s dealing with occasional swelling after a long flight is a very different situation than someone in their late 70s with swelling alongside shortness of breath and a history of heart disease. So if you are comfortable, tell me your age in the comments. It genuinely changes what I would prioritize and shapes what I cover next. Let me stop and give you a number, because numbers tend to stick better than general warnings. Chronic venous insufficiency is estimated to affect a substantial share of adults over 65 to some degree, making it one of the most common circulatory conditions of aging, and yet one of the most under-discussed, largely because the swelling is so easy to write off as ordinary. Here is something most people never consider, and it might be the most important sentence in this entire video. The absence of pain does not mean the absence of danger. Some of the most serious causes of leg swelling, early heart failure, early kidney disease, a slow-growing blood clot, can all present with swelling that does not hurt at all in the beginning. Pain is not the warning system you can rely on here. Pattern, timing, and symmetry are. Let us move into the second thread I opened earlier, because I promised I would come back to it. Swelling that improves overnight and returns predictably each evening is your body's plumbing struggling against gravity in a fairly manageable way. Swelling that starts staying present even in the morning, that does not fully resolve overnight anymore, is a meaningfully different signal. It tells you the mechanism driving the fluid retention has outpaced your body's overnight ability to redistribute it. That shift, from swelling that resolves overnight to swelling that lingers into the morning, is one of the clearest signs it is time to stop watching and start asking. I also want to be honest with you about something that surprises people. Even harmless, purely mechanical venous swelling is not something to simply tolerate indefinitely. Left unaddressed for years, chronic venous insufficiency can progress to skin changes and, in more advanced cases, slow-healing sores near the ankle that become genuinely difficult to treat. Catching and managing it early is far easier than treating it once the skin itself has been damaged. Now let us build your actual plan, the steps I would genuinely give a patient sitting across from me describing exactly what you have been living with. The first step: elevate your legs above the level of your heart for 15 to 20 minutes, 2 to 3 times during the day, not just once at bedtime. Lying on the floor or a bed with your calves propped on 2 or 3 pillows works better than a recliner, because a recliner rarely gets your legs fully above heart level. The second step: build in movement breaks every 30 to 60 minutes if you sit for long stretches. You do not need a full walk. 10 simple ankle pumps, pointing your toes down and then flexing them up toward your shin, repeated 10 times, actively engages that calf muscle pump and pushes pooled blood back toward your heart. The third step: moderate your sodium intake gradually rather than eliminating salt entirely overnight, which is rarely sustainable and can leave food tasting unpleasant enough that people abandon the change within a week. Focus first on the biggest hidden sources, canned soups, deli meats, and restaurant meals, before worrying about the salt shaker on your own table. The fourth step: if you sit for long periods at a desk or during travel, consider a properly fitted pair of graduated compression stockings, worn during the day and removed at night. If you are unsure of your size or the right compression level, please talk to your doctor or a pharmacist before choosing one, since fit and strength genuinely matter for safety and effectiveness. The fifth step: track the pattern honestly for 2 weeks. Note whether it is one leg or both, whether it fully resolves by morning, whether it comes with shortness of breath, chest discomfort, or sudden weight gain, and whether it started with a new medication. A simple note on your phone will be more useful to your doctor than almost any single test. The sixth step: if you drink alcohol regularly, know that it can worsen fluid retention and dehydrate your tissues at the same time, a combination that often makes next-day swelling noticeably worse, particularly if you already have some degree of venous insufficiency. The seventh step: if you are taking a calcium channel blocker or another medication known to cause swelling as a side effect, please talk to your doctor before making any changes. Do not stop it on your own. Bring the timing connection to your doctor at your next visit so the medication and dose can be reviewed properly, because abruptly stopping a blood pressure medication carries its own real risks. The 8th step. Weigh yourself at roughly the same time each morning for 2 weeks and write the number down. A sudden gain of 3 or more pounds within 2 or 3 days is one of the clearest early signals of fluid retention related to the heart or kidneys, often showing up on the scale before the swelling is obvious to the eye. A steady weight is reassuring. A sudden jump is exactly the kind of detail your doctor wants to hear about right away. The 9th and final step. If you notice sudden one-sided swelling, warmth, redness, or calf pain that worsens when you flex your foot, or if swelling appears alongside shortness of breath, chest discomfort, or a rapid, unexplained weight gain of several pounds, do not wait for your next scheduled appointment. Contact your doctor or seek same-day care. This is the one step on this list where waiting is genuinely the wrong choice. I want to be honest about something that happens with almost everyone who follows steps like these consistently. Somewhere around week 2, the swelling noticeably improves. Your shoes fit again by evening. That is exactly the moment most people quietly stop doing the elevation, the movement breaks, and the stockings because the visible problem seems to have resolved itself. I want to reframe that moment for you right now before it happens. Feeling better is not the finish line. It is proof the plan is working and the underlying pattern that caused the swelling has not gone anywhere. Staying consistent after you feel better is the real test. I also want to hear from you directly. If you have your own story with this, whether it turned out to be nothing more than a long day on your feet or a real diagnosis that changed how you take care of yourself, I would genuinely like to hear it in the comments. And if there is a related topic you would like me to cover next, tell me that too. Before we close, I want to say something simple and genuine. Thank you for spending this time with me today. I know there is no shortage of places you could have spent the last half hour, and the fact that you chose to spend it learning how to understand your own body means something to me. If this video helped you look at your own ankles a little differently tonight, please consider subscribing, giving it a like, and sharing it with someone who has quietly been dealing with the exact same thing. And finally, please remember that this video is meant to help you understand your body better, not to replace an actual examination from your own doctor, who knows your specific history and health in a way I simply cannot from here. If anything in this video sounded like your own situation, especially anything involving one-sided swelling, pain, shortness of breath, or sudden weight gain, please bring it to your doctor soon. You deserve real answers and you deserve to feel confident in your own body again.